I think a lot of people didn't realize how much the federal subsidies brought down their monthly premiums.
Right.
And when you're faced between paying your health care premium and paying rent, you're going to choose rent.
Of course.
But then what does that mean for the rest of us who are in the system when you have all the kind of healthy people leave that system? So there are about 2 million people who got their insurance through Covered California Marketplace. But without these federal subsidies that help to keep premium costs low, Covered California estimates that about 400,000 Californians will leave the exchange and simply go without health insurance.
Oh, the mailman's here.
Janelle Peterzak owns a novelty shop in Yucca Valley in the high desert near Palm Springs.
How are we doing?
We're good.
She's the type of person who always tries to look on the bright side, but it's been hard to do lately.
I guess I just feel overwhelmed.
Janelle says tariffs on supplies from India cut into her profit margin last month by 70%. And then there's the issue of health care. Her 2025 premium was $450 a month, but she qualified for subsidies based on her income, so she only paid $27 a month. For 2026, if Congress doesn't vote to renew those subsidies, her monthly premium will skyrocket to $511 a month.
It's pretty scary. I can't afford $500 a month, so I'm not really sure what I'm going to do.
At 45 years old and healthy, she's considering dropping her insurance altogether.
I have been reading that when you go to the doctor and you just pay cash, it's actually a lot cheaper than if you go through insurance. I guess I'm pretty low risk at the moment.
If healthy people pull out of the insurance marketplace, it leaves seniors and the sick who can't go without coverage.
And if that decision happens over and over again in a lot of households, then the people who stay in the insurance pool are going to be sicker and people who need more health care. And that's going to increase the medical spend for the insurer. And the next year, they're going to have to increase their premiums. And we worry that then it leads to a really high-risk pool of people who are expensive to insure, and things become less and less affordable for them.
Erin Duffy is a scholar at the USC Schaefer Center and an expert on public health policy. She cautions that even the young and healthy need to have basic insurance.
If more people are bypassing primary care preventative services and relying on the emergency room when they get very sick, could really strain our infrastructure in the emergency room.
So longer wait times, harder getting care.
That's right. Yeah, longer wait times and more strain on staff.
But some will choose to be cash-paying patients. And Dr. Sulana Misra is a primary care doctor in Tarzana who only accepts those who pay cash. It's an option known as direct primary care.
It's a monthly membership. You pay for the doctor and you get near unlimited access.
Monthly memberships range from $150 to $250. No insurance, no office visit charges, no copays. And ultimately, at the end of the day, people can't afford these premiums.
No, you have to choose between food or a home and these premiums. Sometimes it's not even a choice. It just must be dropped.
Many of Dr. Misra's patients have catastrophic insurance for a serious or life-threatening illness or accident. But she suggests for everyday health care, insurance is not needed, especially if premiums continue to skyrocket. She says insurers inflate prices to make you feel like you're saving money.
But we're realizing that when we actually plug in the numbers or ask what's the cash pay price, often it's less than your copay with insurance. So you don't even need your insurance. Sometimes you're paying more for blood work or imaging than you would if you just asked what's the cash pay.
Do you need an email or text receipt?
And that's what Janelle says she will now explore, but she isn't happy about it.
I guess I just feel like the citizens are being left behind.
Another change, if those subsidies aren't renewed, Covered California enrollees who make more than $62,600 will lose financial aid altogether. Now, coming up in the next hour at 9 o'clock, we're going to show you some websites where you can actually go on there, say what preventative service you want, like a mammogram, and it spits out prices at different locations, cash pay prices. So if you only have that catastrophic care and you don't have like a regular HMO or PPO, you still need to get those preventative services, right? So you can go on there and shop around and know up front what you're paying, which healthcare is like one of the only services where we go in and don't know what we're going to pay, right? We would never do that at a restaurant or on an airline. We'd never accept the price after the service was rendered.